Hey, good afternoon, everyone. And today we're here for a special council meeting, Thursday, November 7th, 2024. And just a note that the webinar will be recorded and published to the city's YouTube site. The first item on the agenda is that the agenda for the special council meeting be adopted. Someone make that motion, please. Councillor Butler and the
Second
seconder.
that. I'll second it.
Okay, thank you, Councillor Cashel. All those in favor? That was carried. I can't see, Councillor Wilson.
Oh, my bad. Yeah, I'm in favor.
Okay. So that was carried unanimously. Thank you. The item on the agenda today is the Health Canada Emergency Treatment Fund, and it's a recommendation before you. I just want, sorry, I'm just flipping the pages here. Just give you a little bit of information on this proposal that we have. And before we go in for the recommendations. So the federal government has opened up a fund for $150 million across Canada. And it is for the purpose of helping communities that are, working with the drug overdose crisis, the housing crisis, wanting to help, with the local public health issues that are in the community. I've been working with Interior Health with this proposal, and it's one that has come to us fairly quickly, unfortunately. But there has been a lot of work put into it. It's also to help provide like rapid response to emergent and critical needs that are related to the substance use and overdose crisis. And we have come forward with two priorities out of our discussions for the communities, for the community to be able to work with these issues that are, affecting our community. And one of the priorities, and we have talked about it before through our Trail Community Action Team, is the pharmacy window at in the city of Trail. We can't name a pharmacy, of course, at this time, because if the grant does go through, it will be put out to tender. And but the idea of the pharmacy window is for people that are on the OAT program. They can go into the pharmacy in a safe place and acquire their products and take their products supervised, and then be able to leave the pharmacy. The problem now that we see in our community is that there's certain individuals from the vulnerable population that aren't allowed in the pharmacy for whatever reason, whether it's disrespectful actions or not adhering to the rules in the drugstores and stuff like that. So the idea was put forward before for the pharmacy window. And that is one of the proposals. And the other proposal is for a van, van that is in the community, goes in, it's very similar to the Anchors van out of Nelson. And that is actually the idea that we are looking at, is to have one of those vans that come into our community. And we'll do outreach work with the vulnerable population that are unhoused in the community. And that includes wound care, giving them some special support and services. Anyone that was at the Housing Summit in 2020, 2, I believe. They had one of the vans at the housing summit and we had an opportunity to tour it. And so that is the same idea that we are looking to propose for the city of Trail, to have one of those right in our community, our very own van that stays in our community and does the outreach work out in the neighborhood and where people are. So I don't know if everyone has had a chance to read the proposal, if there's any questions that I can give you before we go into the recommendation. And I, also wonder if CAO McClure or Ms. Lucchini has anything to add to that I have missed. And I apologize again, I know it's coming to you very quickly, but the deadline is November 8th, so we need to finalize this as soon as possible if it's something that council wants to move forward with. Councillor Cashel.
Thank you, Mayor Jones. Concerning the pharmacy window, without naming the pharmacy, do we have anything on file from a contractor to give us that $50,000 estimate? And I'm assuming the building owner would have signed off on that by now. Like that's all been already done. Our due diligence on that is complete.
I've seen the plans for the window, Councillor Cashel. Unfortunately, it's not in your package today. We have seen the plan and the budget for that pharmacy window, and that's how we came to that number.
Okay.
So yes, I mean, there is conversation with one pharmacy that gave us that information for sure, but I mean, the proper protocol is put it out for tender and make sure that we're doing everything.
So we're confident, based on the documentation that you've seen, that the $50,000 estimate is a fair estimate for that.
Yes.
The next question has already been answered. The van in question is going to be dedicated to trail. And I'm just curious if Interior Health or any of your contacts have been able to give us any concrete data on how many individuals this van could potentially connect in their outreach services. Like how many folks right now? I know we have 25 staying in our shelter. Do you have any update from any of your sources, Interior Health included, that would let us know how many individuals are living rough on our streets right now?
Well, I can tell you, Anchors is also involved from Nelson in this proposal as well. And we know that Trail has approximately 40 people that are living unhoused and out in the community. So it wouldn't be used every day, because if you look at the item number 4, they're looking at part-time staff in there for the van. So it would be a couple of days a week that it would be out there, and yeah.
Okay,
So
40 is the number that we're working with right now. Because okay, thank you for that.
Yeah.
Thank you very much. That answers my
Okay.
questions.
And Councillor Hanson, you had your hand up.
I just want to clarify. So the city is basically taking the money as a holder for Anchors. So it's not a city responsibility at all. We're just basically the flow through for the funding. So
Yeah.
there's zero responsibility on the city to provide any of these services, because I really want to be clear that outreach and anything to do with any of that is IH. That is not the city's responsibility.
Right.
So this is just a basic flow through for funding, because someone's got to hold the money for Anchors for them to be able to do this.
Yes,
Is
you're
that correct?
correct.
Okay. The other question I had is, I mean, I think, how much commitment of outreach does this give it? I know you just said like a couple of days part-time for someone, but I mean, if that means we have our outreach nurses, plus now we have other individuals out on our streets, that relieves probably some pressure off of bylaw, that probably relieves some pressure off of the first responders and responding to overdoses in our in our downtown core, etc., and then being able to, is that the role that Anchors is then going to be playing?
You know what, that's probably a good question. I'm not sure. And I think that the increase or the amount of usage that the van gets would probably increase with the severity of the situation on the streets. Unfortunately. But you're right, it does take some pressure off of our bylaw officers, or more importantly, off of the first responders, the RCMP. Yeah, it's, you know, I just think that it's going to relieve the pressure out there. Right now, there is nowhere for these individuals to go to get the wound care that they need if they're, or, you know, to get any services that they need, or just to talk to a nurse or someone that has the knowledge, the medical knowledge and ability to help support them. And this is what this van would do. It would go to where the people are out in the community. So I don't know if there's any other questions. I hope that you've received enough information on this to make a decision. We had several discussions on the priorities that we wanted to bring forward. It's money, it's an opportunity that we don't want to miss. And so that's why it's coming to you, you know, quickly like this. But I felt comfortable bringing it to council because we've had the conversation about the pharmacy window before. And, you know, with the Trail Community Action Team and how they're struggling to get money to make that happen. And here's an opportunity. If this is something that council feels that they want to move forward with, here's an opportunity to make that happen and to be able to serve those individuals. And also, you know, the van is something that can move, you know, within the community and be a part of it. And it's the City of Trail's van that it will be staying in Trail. So I think that's a bonus as well. But yeah, I don't know if there's any more questions or comments or.
Well, when I read the narrative, Mary Jones, if I can,
Yes.
that Miss Moretto put together, the one piece, and again, I'm not making the application, but that I noticed was missing was the fact that Trail is a hub for 5 municipalities with over 20,000 people. We have the regional hospital. We are now the home of our homeless shelter. These ingredients weren't mentioned in the narrative, and I think it misses a big point there, that we're not just serving Trail, we're serving Roslyn, we're serving Janelle, we're serving Montrose, we're serving Fruitvale, and these neighboring communities that some of the vulnerable folks come into Trail for the services. And I found that when I read the narrative, that piece was kind of missing. So I don't know whether that's something that could be addressed just to kind of add more emphasis on that. But I just wanted to make that comment. Thank you very much.
Yeah. No, I agree. Thank you for that, Councillor Cashel. Ms. Lucchini, is there an opportunity to add something to that? Maybe if we do a cover letter to the grant or something? I don't know. I'm asking for guidance on this because I know we are short for time.
Most certainly, Mayor Jones, we can add that comment from Councillor Cashel to the grant. The grant will be, still has to be submitted and hasn't been prepared pending council's approval.
Okay.
But I have made a note of that,
Okay,
comment.
that's great. Thank you. I think that is important information as well. Okay. Any other questions or comments? Or I'm sorry, I still don't see Councillor Wilson. I don't know if he has any comments or,
All good.
okay. Councillor Butler, have you got any comments or questions about it?
No, not at this time. Thank you, Mayor Jones.
Okay. Okay, so the recommendation is before you. And I'll just read that out, just so that we have a good idea of what we're putting forward here. So the recommendation is that council support a grant application in the amount of $490,000 to the Canadian Emergency Treatment Fund 2024 to support the following projects within the city of Trail and anchors entering into a third-party agreement to receive the funding if approved. Number one is a capital purchase of a fully equipped medical van for $260,000. Item number two, a yearly operating cost of the van, including insurance, maintenance, gas for $30,000, and that would be 2 years at $15,000. Number three is the pharmacy window construction for $50,000. And number four is the anchor staff position to oversee the pharmacy window project and operate the van, $150,000, and that's for 2 years, including mandatory employment-related costs. Is there someone that would like to move that recommendation, please? Councillor Butler, thank you. All those in favor?
We need a seconder, please, Mayor Jones.
Oh, sorry, yes, the seconder, please, Councillor Cashel. All those in favor?
Yeah, I'm in favor if you can't see.
Okay, thank you. That was carried unanimously. Thank you, guys.
Thank you.
Thank you.
Well, I wish them good luck with this.
Yes.
And thanks for being so easy to get together.
Motion
Goodbye,
to adjourn?
everyone. Sorry?
A motion to adjourn?
Yeah, motion to adjourn. Thank you. Councillor Butler and Councillor Hanson.